So, dopamine. The good old dopamine rush. What is it? How does it pertain to mental health? I mean, for people who have, mental health conditions, what should they know about dopamine? So in today's video, I'll be discussing 5 important things to know about dopamine and how it pertains to mental health. This is your daily dose of mental health with Adam. Please like and subscribe to the channel. Let's jump right on in to number 1 in pertaining to dopamine. Number 1 is dopamine. Dopamine, in essence, is the brain chemical that focuses you on a task in particular and completely focuses you on this task. So when somebody says they have a dopamine rush, a lot of times that's because they are performing a task and they have met certain thresholds of where they've failed in the past to now that they can push forward through, resulting in these mini dopamine rushes. Dopamine is also primarily the chemical that drug addicts seek. In a lot of medications, it's all about the dopamine release. And that is one thing that is very important to understand, that when you do use drugs, and this isn't just pointing to street drugs, this is pertaining to any sort of drug, caffeine even, understand dopamine will be pushed, sometimes unnecessarily in result. And then it will trick the dopamine receptors into not having to promote or create more dopamine or use it, which can cause crashes and those withdrawal symptoms from dopamine. So in essence, the first thing we need to understand is dopamine. Let's jump right on in to number 2 in regards to norepinephrine and noradrenaline. So number 2, norepinephrine and noradrenaline are essentially the quitting chemical. And what you might ask, what is the quitting chemical? So in essence, when you are, for essence, let me just say this. Let's say, so I'm running every day. And I have been unsuccessful with my run for the day. You have that negative self-esteem going. It results in an increase of norepinephrine and noradrenaline, which will increase, and as a result, it will lower your dopamine levels too, which that is the number one reason why, people quit. That's the number one reason. And a lot of times too, this will result in things like agitation, sadness, and will make you completely quit. Because remember, dopamine, what it helps you with primarily is being task focused and driven. Let's jump right on in to number 3 now. So as stated a little earlier, number 3, understand that when you are completing or working on a goal or a task and putting everything into it, that you will fail, which will result in agitation. It will result in stress, sadness, and you will think you can't go on. So when you feel this going on, when you are, for example, once again, let's say I'm running and I can't get my 5K time down to like a 17 minute or 16:59, I'm actually driving up my norepinephrine levels and the noradrenaline levels, which could actually potentially make me quit the task, or do I keep pushing forward and complete it, which will result in more dopamine, and also you will, as a result, be rewarding your dopamine system. So let's jump right on in to the fourth topic that I feel like is very important, and the 5th, which is as well. So number 4, let's go right on into it. Okay, so number 4. This is really critical in understanding when you've been through these ups and downs and you've failed, but you've continued to go forward. You have to understand that these people that are pushing forward, they understand the importance of having a positive mindset. You got to understand with the new task, if you don't have a positive mindset throughout it, now you can feel down at times, but you push forward. If you don't have the right mindset going into it, then there's no point in trying. You have to have the mindset. And what do I mean by the mindset? This might confuse people. Well, then how do you know what drives you? Well, yes, you try things, but what are you quitting? But there is always, for me, I feel like there's that one thing that you try that first time and you have a little bit of success, or you could have just a little bit of failure with it. And that is going to kick in that drive for you to be like, let me maybe try it again. And you might fail the next time, but you continue to push. So number 4 was all about mindset. Let's jump into the 5th aspect of dopamine, which is essentially the dopamine system. Let's jump right on. So as stated earlier in number 4, you have to have mindset with everything, because the farther you take that task, ultimately what will happen is the dopamine, it'll be reversed. The dopamine will actually lower or even suppress the norepinephrine and the noradrenaline. So that is one thing that is very important, again, with number 4. So number 5, understanding the dopamine system. So essentially, once again, when small milestones are reached, not only are you going to be going forward, but your dopamine that you're releasing when you get through that failure is going to tighten your focus on that task and give you more energy to go. That's another key aspect of this. So understanding that when you beat these failures, you're going to be even more invested into it. You're going to tighten that focus, which ultimately will result in success at a smaller level, and even a higher level, depending on how you want to scale. But once again, the reason I do this video in regards to mental health is understanding how our brain works. If we have anxiety, depression, OCD, if you have schizophrenia, anything mental health, this is something that all of us should know if we have the cognitive function to, which, how I try to break this down is pretty easy. Understanding if you are post a drug addiction, if you just started one, your dopamine will primarily be depleted. And understanding that you're going to have a lot of trials and tribulations and failure, and a lot of even potential failure along the way, and negative emotions. But as your dopamine starts to naturally come back, and through things like exercise and healthy lifestyle changes, that is when you will notice you won't have those super lows like you were when you were in withdrawal, because your dopamine is back in check. It's back in check. And lastly, not even to somebody who's using drugs, but to anyone in general out there, understanding once again how the dopamine system and circuit works can really help you apply it. Like with me right now, understanding that I'm gonna have failures. I'm running every day. I'm gonna have failures where I'm gonna feel a lot weaker some days, where some days I can do 5 miles, some days I can do 3. But ultimately, if I have a bad slump, yeah, it's a slump, but I'm going out there every day. And then through doing that, you will increase your dopamine a little by little. Your norepinephrine will drop, which will result in that tightening of mindset, which ultimately leads to, when you have these breakthroughs, those internal rewards you should be giving yourself. I'm not a big fan, actually, of external rewards anymore. Here and there, they're fine, but external rewards is ultimately not what fixes or even helps your mental health, and more importantly, your dopamine system, which is what you are wanting to protect. That is what you want to protect. Even if you're somebody who's used drugs for 20 plus years, you can still get it back intact if you're willing to put in the work. It's going to suck some days, but you can do this. You can. I hope this helps someone out there. This is your daily dose of mental health with Adam. I love you all. I'm still running every day. Check out that playlist, 365 Days of Running. Check out Perspective. Check out my drug education, my story of drug addiction. I love you all. Look out for the next video dropping in a couple days, and of course the shorts drop in daily. Peace.